Namaste Bitya, Hamesha Khush Raho Bitya. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this series of lectures, we are discussing about the various genetic diseases. In the last few lectures, we have discussed about the introduction of the genetic diseases. Then we have discussed about Klinefelter syndrome. We have discussed about the etiopathogenesis of Klinefelter syndrome, the various clinical features, how to investigate the case of Klinefelter syndrome, and how to manage it. Today, we are going to discuss with another important disease that is related to the genetic disorders, that is the Turner syndrome. So what is Turner syndrome? What are the clinical features of Turner syndrome? How to investigate a case of Turner syndrome and how to manage such a case. This we are going to learn in today's lecture. So we are going to learn everything about Turner syndrome today. That is essential for your practice. We are also getting questions, usually short note on Turner syndrome. So you have to prepare it from the point of view of short note only. But in general also genetic diseases can be asked in the full question. So what is Turner syndrome? Turner syndrome, it is affecting approximately 1 in 2,500 females. In the Klinefelter syndrome, we have learned that it was mainly affecting the males because there was a female chromosome and a male chromosome, X and Y. But Turner syndrome, the phenotype is usually female. Whereas in the Klinefelter syndrome, the phenotype was male. The genotype as well as phenotype both were male. And there were deficiencies in the hormones or hypogonadism was there. Now let's start with the Turner syndrome. Turner syndrome is basically phenotypic female, genotypic and phenotypic female. And it is affecting 1 in 2,500 females. So it is comparatively less common as compared to the Klinefelter syndrome. And the syndrome is classically associated with 45 exokaryotype. So in case of Turner syndrome, we are having 45 exokaryotype, means there are 45 number of chromosome. One chromosome is deficient from the normal number. Usually we have 46 number of chromosome with XX or XY. But what happens in Turner syndrome, because of the non-disjunction of the genes, there is absence of gene, and that is producing 45 exo, means one chromosome less that could be seen in the karyotype. But the other cytogenic abnormalities may be responsible, including mosaic forms. So this is Turner syndrome is mainly affecting females. 1 in 2,500 female is getting affected, and it is classically associated with 45 exokaryotype. But other cytogenic abnormalities may also be responsible, which includes the mosaic form, example 45 exo or 46 XX or 45 exo or 46 XY. And there is partial deletion of the X chromosome. So there is partial deletion or the non-disjunction, because of which there is one chromosome short in the genotype. Now, what are the clinical features? Whenever a patient of Turner syndrome is coming to us, how will you identify such a female? So there are a lot of features, a lot of characteristic features. I have also given a pictorial or the diagrammatic presentation of the clinical features that are associated with the Turner syndrome. Turner syndrome is very frequently asked in the examination as a short note. So this is an important topic, important genetic topic that you have to remember from the examination point of view. And this is not very difficult, but quite easy to understand, easy to remember, and easy to write. So what are the clinical features? What are the features with which a patient can present to us with the Turner syndrome? So the clinical features in Turner syndrome results from haploinsufficiency of multiple X chromosomal genes. So as we have discussed that Turner syndrome is because of the deficiency of one X chromosome. So there is haploinsufficiency of multiple X chromosomal genes, and it is characterized, the Turner syndrome is characterized by bilateral streak gonads. So the patient is having bilateral streak gonads. Streak means which are not developed properly. There is primary amenorrhea. So because of the non-development of the gonads, the patient is usually female because A male chromosome is not present. So phenotypic and genotypic female is present, but the patient is not having the clinical features. The secondary sexual characters are not properly developed, and therefore the external genitalia is of female variety, female type, but the symptoms are deficient. So there will be bilateral streak gonads, means the gonads are not properly developed. The patient will have primary amenorrhea. That means the patient will not develop menses any time in her life. The stature will be short. So the patient will be having short stature. There will be bilateral streak gonads, and there will be primary amenorrhea. And there are multiple congenital abnormalities that you can see with the Turner syndrome in the phenotypic females. So phenotypic means physical characteristics of females are present, external genitalia are of female variety, but the symptoms, the secondary sexual characters are not properly developed. There are a lot of clinical features that you are going to see in case of Turner syndrome. So let me discuss with you certain features of the Turner syndrome. The patient will be of short stature. They will be fish-like mouth with high arc palate. So the patient will have a high arc palate and fish-like mouth. There will be autoimmune thyroid disease that will be present with 20% of the patient. So the patient will have short stature. There will be fish-like mouth with high arc palate. There will be autoimmune thyroid disease in 20% of the patients with Turner syndrome. There will be coarctation of the aorta. So this coarctation we are going to discuss with the cardiovascular diseases in the final year. And there will be bicuspid aorta valve. In the heart, we will also be having aortic root dilatation. So we are having a lot of abnormalities related to the cardiovascular system, which includes coarctation of the aorta, bicuspid aortic valve, aortic root dilatation with coronary artery disease and hypertension. So all these complaints are associated with the cardiovascular disease, that is coarctation of aorta, bicuspid aortic valve, aortic root dilatation, and coronary artery disease. And also hypertension. The patient will be hypertensive, that is the blood pressure will be raised. There will be abnormal liver function test. So in most of the females, the liver function test will be abnormal, which consists of around 30 to 80% of the cases. There will be streak gonads, means the gonads are not properly developed, and there will be gonadoblastoma with XY mosaic pattern. The patient will also have certain psychological problems. Psychological means the mental problems will be present in the patient with Turner syndrome, and there will be impaired visuospatial processing, means whatever the patient is looking, there will be difficulty in perception of those things. There will be reduced IQ. So such patient will be having low IQ with ring chromosome X. The patient will have low set of ears with sensorineural conduction hearing loss. So the ears will be small with sensorineural hearing conduction loss. There will be webbed neck. The patient will complain of the webbed neck, means you will not see the neck, proper neck, but there will be webbing of the neck. And there will be widely placed nipples. The nipples of the female will be widely placed and without any development of the breast. So the chest will be like a shield chest. So the patient will present like a shield chest with widely spaced nipples. There will be wide carrying angles of the elbow. So in the elbows, there will be wide carrying angles, and the patient will be suffering from the type 2 diabetes mellitus in 10 to 30% of the cases. The patient will also complain of inflammatory bowel disease. So in certain patients with Turner syndrome, there will be inflammatory bowel disease that is going to affect 0.2 to 0.3% of the patient. Some patient can also present to you with horseshoe kidney or the other renal or collecting system abnormalities. There will also be reduction in the bone mineral density, and you can also observe lymphedema of hands and feet in the 30% of the cases. So let me revise all the features. There will be primary amenorrhea, short stature. There will be bilateral streak gonads with multiple congenital abnormalities. The individual will be of short stature with fish-like mouth, high arc palate. There will be webbed neck. There will be autoimmune thyroid diseases with certain cardiac disease, which includes coarctation of the aorta, bicuspid aortic valve, aortic root dilatation, coronary artery disease, and hypertension. The liver function test will be deranged. The gonads will be streak gonads with gonadoblastoma. The patient will also be complaining of certain psychological problems, which includes impaired visuospatial processing and reduced IQ. And the ears will be small with sensorineural conduction defect, hearing loss. There will be webbing of the neck, shield chest with widely placed nipples. The patient will be suffering from type 2 diabetes, and some patient will be having inflammatory bowel disease. There will be wide carrying angle of the elbows, and some patient can also present with the horseshoe shaped kidney and the other diseases of the renal collecting system. The bone mineral density will be reduced, means that the individual will be prone for development of fractures. Very commonly, these patients will be having fractures, and there will be lymphedema of the hands and feet. Why I'm repeating these symptoms again and again? Because these symptoms are asked, this particular disease is asked many times in the examination. So if you will learn these symptoms here itself, then it will be very easy for you to answer those questions and secure good marks in the examination. Now, as I have already told you, the genital tracts and the external genitalia, especially in the Turner syndrome, is of female variety. All right, so female character. So phenotypically or by look, the patient is of female character, is basically female, but the secondary sexual characters are not developed. There is no menses, that is primary amenorrhea is there. The gonads are streaked, means they are not developed properly. All these things you are going to see. The ovarian tissue develops normally until the 3rd month of the gestation. So till the 3rd month of the gestation, the ovarian tissue is developing properly, but thereafter there is gonadal dysgenesis, means the ovary will not develop properly. Now, how to diagnose a case of Turner syndrome? Whenever a case of Turner syndrome is coming to us, then how can we diagnose such case? So the most important diagnostic method for diagnosis of Turner syndrome is by karyotyping. Although there are a lot of symptoms that we have discussed just now, by which we can get a rough idea that yes, this particular patient may be having Turner syndrome, but the final diagnosis can only be done by means of karyotyping, that is by the genetic checking whether the patient is having XO or not. Prenatally, so if we are trying to check for the case of Turner syndrome before birth, then the diagnosis of Turner syndrome is usually made incidentally after chorionic villi sampling. So during gestation, it can be the diagnosis of Turner syndrome can be made accidentally by the chorionic villi sampling or amniocentesis for unrelated reasons such as advanced maternal age. So during the advanced maternal age, there is more increased risk of development of the genetic diseases. So for checking all these things, especially in the advanced ages, we are doing karyotyping or the amniocentesis for checking various diseases. In such cases, accidentally, Turner syndrome is diagnosed. Prenatal ultrasounding finding will include increased knuckle translucency. So in the prenatal ultrasound, accidentally it can be found by checking for the increased knuckle translucency. The postnatal diagnosis of Turner syndrome should be considered in female neonates. So if we are checking for the postnatal diagnosis, after birth diagnosis of the Turner syndrome, it is considered in the female neonates or the infants with lymphedema. So if there is any lymphedema after birth in the children with knuckle folds, there is low hairline and left-sided cardiac defects in the girls with unexplained growth failure or pubertal delay. So in all those females who are not having proper growth, or if there is absence of secondary sexual characters or absence of development of the menses in the females during the puberty, then in such conditions, you can check for Turner syndrome. Or if there is any left-sided cardiac defects or low hairlines or knuckle folds are present, then we can check for the Turner syndrome. Diagnosis should be considered in all the women who present with primary or secondary amenorrhea. So if a patient is coming to you with primary or secondary amenorrhea with all the features that I have discussed with you, widely spaced nipples, shield, chest, short stature, and all the other features, then we have to check for the gonadotropin levels that will be elevated. Now, detailed cardiac and renal evaluation has to be performed for the diagnosis, because we have seen a lot of cardiac abnormalities and also the renal abnormalities like the horseshoe kidney. The management of the case. Now, how to manage a case of Turner syndrome, because this is a genetic disease. So how will you manage it? You cannot change the genetic composition of an individual. So the management of the girls with Turner syndrome requires multidisciplinary approach, because there are a number of organs or the number of factors that are involved in the treatment. So prophylactic gonadectomy is recommended in such individuals. So if in such individuals, you have to remove the gonads, means prophylactic gonadectomy, because it can lead to the development of the cancer in the later stage. So in the individual with 45XO or 45XY mosaicism, because there is increased risk of gonadoblastoma. So these gonads can become cancerous in the later stage. Adults with the Turner syndrome require long-term estrogen replacement therapy. So in the adults, it will, because of the gonadal dysgenesis, the gonads are not able to produce the hormones properly. Therefore, estrogen replacement therapy has to be given, and it has to be monitored periodically for the development of the aortic root dilatation, hearing losses, and other somatic complications. So all the symptoms that I have discussed, if present in the patient, have to be treated accordingly. And long-term follow-up of the woman with Turner syndrome involves careful surveillance of the sex hormone replacement. So whatever hormones you are supplementing, you have to do the careful surveillance of those hormones, and it requires reproductive function, bone mineralization, cardiac function, and aortic root dimensions with blood pressure, weight, glucose tolerance, hepatic and lipid profiles, thyroid function, and hearing. So all those symptoms that we have discussed, we need to carefully observe for all those symptoms with the life. Like long-term follow-up will involve sex hormone replacement, reproductive function, bone mineralization, because there is decreased bone mineral density. So bone mineralization, cardiac function, and aortic root dissection with blood pressure, weight, and glucose tolerance. Hepatic and lipid profiles are needed to be done with thyroid function and hearing testing. Now, what are the complications that can occur with the Turner syndrome? Individuals with congenital heart disease are associated with increased risk of aortic dissection. So those individuals which are having high congenital heart defects are at a more risk for development of the aortic dissection. Individuals found to have congenital renal or urinary tract malformation in 30% of the cases are at a risk for urinary tract infection, hypertension, and nephrocalcinosis. So in the complication, we can have aortic dissection. In the renal system, we can have urinary tract infection, hypertension, and nephrocalcinosis. So this is all about the Turner syndrome. I hope you must have understood this session properly. Now it's your homework to go through the book, and you have to prepare the e-notes, the notes yourself. I have also uploaded the e-notes of this particular session on the portal, and you can check the e-notes and try to solve the question that I have given you on the e-notes. So this was all for today. This session is powered by Digital Version 2.0, Jyoti VIDYAPEETH Women's University. I hope you have understood the session properly. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. In the next lecture, we will be discussing about obesity. So this was all for today. Thank you very much. Have a good day.